Until 3, this is Millsy at Midday on 882 6PR.
Hey, it's good to be back home again.
Well, quite literally, really. It is good to have him back home. He's been away on a bit of a sojourn treating, I believe, all the grey nomads around the state. Dr. Ryan Lamp from Lamp Chiropractic Clinics is in the studio with us, and he's here to take your questions. 133 882. Maybe you've got an ache or a pain and you think, maybe this bloke can help me. Well, why don't you give it a go? 133 882. Welcome back.
It's good to be back, Millsy.
That's what the bloke said when he was singing.
That was my song, I thought.
Was it?
It is for me.
How was it on the road?
Unbelievable. It's
people everywhere.
Broome is at capacity. There's 70,000 plus people up there, so it's pretty hard.
I heard 80 at one stage.
Could be in the morning. They all turn up on their planes. In the afternoon, they disappear a bit.
Right. What about on the roads, though? There's caravans everywhere, is that right?
Yeah, well, even just booking into places, they go, oh, yeah, we've got one day here. It's like, can I have two? No, sorry.
Just one.
Booked.
So where did you stay?
So we stayed quite a few free camps along the way, along the coast.
What time do you have to get there to take advantage of those places? Because they fill up too, don't they?
Yeah, well, 80 Mile Beach was between Derby and Broome.
Mm-hmm.
So you pull in there whenever, and they'll put you into this overflow site. And then if you get up early in the morning and line up at the reception, then they'll hopefully kick you into a proper site in the morning. So it's that I've always done it that way because they have so many people otherwise just don't turn up and so forth.
And incredibly, you have been doing your work whilst on holidays. Tell us more about that.
Yeah, well, unfortunately, I do talk to people a lot. But, patients are sitting in their cars, driving here, there and everywhere. A lot of the grey nomads or grey snails, the East Coast call them, because they reckon they've got their homes on their back.
Right.
They're driving, and a lot of them are, because they drive so much, they get sore, and sitting's bad for your posture, especially over a long period of time. So I was in there just giving some postural advice, some stretches for them to do, a few little adjustments if I could do it with the tools I had, just promoting what we do as chiropractors to help in the healthcare profession.
It's one of those things, though, like when you are away and you're having to manoeuvre a caravan onto a car or pull the annex out or just lift stuff, it's quite easy to pull a muscle, particularly if you're not that nimble.
Yeah, well, it's about doing it correctly. So if you have a look at the body, between your knee and your hip, that's the biggest, strongest muscle and bone in your body. So when you're doing those things, you bend your knees, you use your legs more than your back, and then that way it prevents these things from happening. So that was what I was giving advice on a lot of the time. Just keep your legs a bit further apart every time you do things, lean forward and back so that you've got pressure in you'll feel it disappear from your back and go into your legs, and then you know you're pretty much doing the right thing.
We're going to talk about the back in a moment, but if you've got a question for Ryan, 133 882, he's here for a good but short time. Let's talk about back pain and the cost to the Australian economy. How many people in Australia during their lifetime would have a problem with their back?
Some studies say between 60 and 85% of the population will have back pain at one point in their life. And it costs, just for treatment, it's about, I think the statistics are a few years old now, but it was $4.7 billion a year people pay for treatment for back pain. And back pain's the third thing that people turn up for healthcare for.
Right, but it's crippling. If you pull your muscles in your back or whatever you're doing to your back, it can be crippling. In other words, you can't even stand up or you can't sit down, you got to lie down and all that kind of stuff. You lose your breath, all that. Having gone through that, it's awful feeling.
Yeah, and then over time you start feeling negative and you start feeling depressed and all those sort of things, because chronic pain brings your mood down and everything. But it's one of those things, firstly, it's so important to learn how to look after your back so you don't get it in the first place. But when you do, you've got to attend to it as quick as possible, and then you've got to do the things to stop it from coming back again. So even, fine 30, go for a walk 3 times a week. Walking takes pressure off your back, keeps fluid moving in and out of the joints, and it keeps your body moving properly. It's this sitting down, people get pain, they get less and less movement, then they get worse and worse and worse. It becomes this big downward spiral.
But when you do your stuff, you're effectively releasing that fluid in between various segments of your body. Is that pretty well what the art of chiropractic is?
So the art of chiropractic is we have joints in our body. There's 406 of them around our body. In between, we have a thing called synovial fluid, which is a lubricant. If there's lubricant in the joint, they move without touching each other. Over time, we lose the lubricant, and then all of a sudden you get pain because the joints are scratching together. And what we do, and I'll make a demonstration here, you hear this sound?
Oh.
It pops. What that's doing is forcing the joint open, and it's redistributing the fluid back into the middle of the joint and helping to lubricate it better. And that's all we do. And so it's a matter of attending to it so that the problem doesn't become chronic. A chronic problem is harder to
So when you start walking and you're thinking after a period of time, oh, my back feels better now, often people associate, well, I've warmed up now, so I'm okay. But is that what you're saying is the lubricant doing its job in your back?
Yeah, so if you have a look at if you're an engineer and you look at the human body and you put pressure sensors everywhere, when you stand, you put the joints at their minimal load. So as you're standing, you're actually almost stretching your spine out. When you sit, you're compressing it. So that's why people get up and they start moving. It's actually taking pressure off the back, the joints are moving, the muscle starts loosening, and that's why most of my patients that come into the clinic go, oh, look, when I get up and walk around for a bit, it gets better. And that's because you're literally taking pressure off it. But if you sit or lie down, it's loading it, and therefore it puts more pressure, and therefore it makes it worse.
So someone that's listening to us today and they're a professional driver in whatever sense, a truck driver or an Uber driver or a taxi driver, whatever, and they're sitting down for the majority of the day, what kind of things can they do in order to avoid having a crook back?
So I do have a huge amount of drivers as patients. So what I get them to do is very simple stretches before they start their shift. As soon as they have a break, they'll do just a simple stretch to hold things open. Obviously, our job is to get them out of pain, get that fluid building up inside the joint. And then the other part of it is then tell them, okay, when you're sitting, make sure your seat's up and forward. Make sure it's in different positions so that you're not always loading at the same point. And then regularly stretch so that you're stretching it before it compresses.
So you're saying change even the way that the seat is shaped. So lean it back, lean it forward.
Yeah, lean it forward, lean it back, sit up as high as you can. The higher you sit it up, the less pressure you put on the back, and you start putting it at the front of your hamstring. So sitting in a chair is better than sitting on a couch, because the lower the seat is, the more pressure goes into the lumbar spine, the lower part of the back.
So once you've had a crook back, it doesn't mean that you necessarily have to have a bad back for the rest of your life.
Well, you need to learn how to get it fixed, and then you need to learn how to manage it. So it's like you and I buy a brand new car, you leave yours out in the paddock, and I service mine regularly. In 10 years' time, they're going to be very different cars, but they were brand new at the same time. So It's about looking after it and making sure you don't know what to do.
I wish I would have met you a lot earlier in my life. 133 882. If you've got a question for Ryan this afternoon, it doesn't have to be about your back. It could be about your neck. It could be about your arms. It could be about your legs. It could be about your whole body. 133 882. We'll take your call shortly. It's 1:15.
Until 3, this is Millsy at Midday.
Yes, indeed. It's 19, make it 18 past 1. Ryan Lamp is with us. He's a doctor, and he's a chiropractor from Lamp Chiropractic Clinics. He's got a lot of great videos, Ryan was telling us off here. If you want to look at stretching exercises, lampchiro.com.au. And if you want to book a consultation, 9361 9300. But he's here for free for you, 133 882. Jane, thanks for holding on. How can we help?
Hey, if ever I hurt my back, it's always in exactly the same spot, though, right hip, sort of halfway between my spine and my side. Does that mean that there's just like an inherent weakness, or is it a damage that I need to be careful of? And like, how can I protect that particular area?
Jane, do you get it when you sit down more than when you stand up?
No, it's usually like if I've kind of pulled it, I do a fairly physical job.
Yeah, okay. And what about if you get your thumb, and is there a spot that you can push in and find it, that tight spot?
No.
No? So it's quite deep then?
Yes, I think so.
Okay. So with that, if you have a look at your pelvis and your low back, quite often if you have a problem there, your body will do everything it can to lean away from it. So the problem's always there, but sometimes you're actually leaning away from it and taking a bit of pressure off the area, and it feels okay or less pain. But then what was going to happen is, as time goes on, it's going to become more and more, you do less and less, and it becomes on a lot more easily. So it's something you need to get addressed and look at. And I guarantee if you look at yourself, stand in front of the mirror when you get home, look at yourself, and you'll see that your pelvis has a twist to it. And what's happened, your problem's there, your body's twisting away, and that's how your body's dealing with it. But each time it comes back, it's got to a point where your body just goes, oh, I can't deal with it at the moment, and then it will lean further. And it just keeps doing that up until a point where you can't lean, and then you'll have a more constant problem.
Okay, yeah, that sounds logical.
Yes.
All right.
So would that have come from, I think I heard it originally sort of lifting and twisting.
Yeah. I don't know if you're listening earlier, but what you want to do is when you lift and twist things with your body, you want to try and use your legs more than your back, and then you'll be okay. So it's just one of the things you need to get treatment.
I think anyone that's had a crook back or a point like Jane's describing is that often comes from one particular event, and so therefore we kind of nurse it, and then we do something out of the ordinary, and then it aggravates it again because we've never fixed it. Exactly. I think that's the point that you're making, and one that we can look at. That method that you say, stand in front of a mirror, where do we put our feet? Do they go side by side,
no.
obviously, but do they at the same level? Or
So what you want to do is just stand normally. So don't even look down, just stand there. And what you'll then look down, you go, oh my gosh, one foot is straight and the other one's out to one side.
What does that mean?
And so what it means, if the buttocks is tight on the left-hand side, that muscle's tight, which means it will pull the left leg out, and then it will sort of correlate with Jane. More than likely, her right foot's going to be out, not parallel, because she's got this muscle that's trying to protect this problem in her low.
So that's a giveaway.
Yeah, so that's what we look at when we're seeing a patient. I walk down the street and go, oh my gosh, that poor person with low back pain.
Right, you can tell.
You can tell because you can see the way they walk and move and so forth.
133-882 if you've got a question for Ryan Lamp, our chiropractor, who's here once a month. G'day, Phil.
Oh, good afternoon. Hey, a strange little question. I'm 62, applying for employment. On the questions they always have, they don't ask, have you been to a physio? They ask, have you been to the chiro? And at my age, you're very nervous about being re-employed. And the first thought pops to mind is, will this new employer think that you've got a back problem and not look at you because you've ticked the box, I've been to a chiro?
I've come across this many times. So people talk to me about, and I've had employers ring me saying, I've got this patient, prospective employee that has a tick the box that says chiropractor. One of the things is people, majority of the time people turn up to us with low back pain, but once we get people out of pain, which is usually quite quick, then we get their body to heal and then we put them on a maintenance program. So therefore, they're the type of person that is looking after their health way better than a lot of other people are. A lot of people wait for pain, pop painkillers, think that's going to fix it. So by putting that down, the back pain thing is a big issue because it's massive and insurance companies don't want to pay out on it. But if you're in that position where you're just going to a chiropractor to keep your back pain gone, then your body should be way better than a person that's not looking after themselves.
Right, but you say it's quite common, what Phil's saying.
As in...
a number of people that come to you say, I've got to fill this form out.
Yeah, I've had it many times before, and it says chiropractor. Even some people go for insurance for
Workers' comp.
life cover or whatever it might be. What do they call that? Yeah, and they go, oh, have you got a chiropractor? Who's your doctor? And they want to know if you've got a back pain issue. Right. And because back pain's so prevalent, it's one of those things where they sometimes have it in there because it becomes, if you're not managing it, it's going to return and they don't want to pay for it.
If you don't put it down, Phil, from a legal point of view, your insurance might be null and void. So you've got to be careful there as well.
Well, that's the concern, but I've found that chiro is just brilliant. And, knowing that might affect my future employment, etc., is just a concern. And I sort of wonder why, if I go to the physio for back problems, why don't they have physio on there as well?
I didn't know they didn't have physio, but I know with a chiropractor, it's like you go, hey, do you go to a dentist? You go, oh, well, yeah, I must have bad teeth. But it's like, no, I go to a dentist to prevent tooth decay. Yeah. So it should be a good thing. As a chiropractor, we get to our patients to prevent them having back pain, and that's what we're trying to achieve.
Yeah. Phil, good luck with that, and hopefully you'll get a gig. Brian has contacted us via the SMS, 0487 999 882. He's got shoulder pain on the left-hand side, which drags his shoulder down when he stands in front of a mirror. Does that mean much?
Shoulder pain is usually to do with poor posture. So you can overuse, if you're left-handed, a lot of people get left-handed shoulder pain, or if they're operating machinery with the right hand, it can be just overuse. But what happens when you've got a shoulder problem, the joints are rubbing together, so all your muscles tighten to protect it and stop this friction between the joints that are unlubricated. So unfortunately, the muscles at the front of the shoulder are bigger than the ones at the back. So automatically, if all muscles turn on, it pulls your shoulder forward and down to protect it. So it's this compensation that your body's doing, but you've got to address the actual cause of it. And a lot of the shoulder problems that I treat happen because between the shoulder blades joints are tight, so people are leaning forward to get away from it, and it then compresses some of the joints in the shoulder.
So your inclination is not to push back, it's to push forward, and that's the worst thing you could do.
Yeah, a lot of people do that. They push back thinking, oh, that's good, feels a bit better, but they're loosening the things in their shoulder, but they're compressing where it originated from in the middle of the shoulder blades. Okay. So it's almost like a catch-22.
Yeah, it's tricky, isn't it? What about when you wake up in the morning and you're feeling stiff, like a lot of people would, when they wake up early in the morning and they think, oh, my back's out, my feet hurt, my legs hurt. Is there any techniques you can do in order to start the day before you even rise?
So a lot of my patients will come in saying that it's worse in the morning. And the reason being is if a joint is scratching, musculoskeletal problems cause inflammation. So inflammation is the fluid your body produces to heal things. And if you get that building up during the night, everything becomes stiff and sore because there's all this extra fluid there. So in the mornings, we get our patients to reduce that sort of pain in the morning is to use ice therapy at night time, so an ice pack. That reduces inflammation before the patient goes to bed, and therefore during the night they've got far less inflammation. They're going to wake up with more movable joints. Yeah. Wow. So an ice pack over the affected area for about 5 to 10 minutes wrapped in a tea towel, that can help reduce inflammation and make you feel a bit better in the morning.
Wow. Graham, good afternoon, mate.
Hi, how you going, Stephen?
Good, thanks, mate.
Chiropractor there.
Yes.
I'd just like to know if you've ever looked at that device, TrueBack. It came from America.
No, I haven't heard of it. There's millions of devices that come on the market every 10 minutes. So tell me a bit about it, Graham.
I had severe back trouble going back probably 7 or 8 years ago where I couldn't even stand up for half an hour and I'd have to spasm and collapse. I couldn't even lift a 10-litre tin of paint. I had to give up painting for a couple of years. And I went to chiropractors and everything else. And I saw this device on late night TV. And actually, one of the people in 6PR have got it now. Now, it's just a device it's just a shape like the Sydney Harbour Bridge, and all it does is realign your spine back to the way it should be. Now, this thing cured me, and I mean cured me. Mm. Like, I've gone pain-free, and I don't use it. I haven't used it for 6 years. I've gone pain-free for 6 years. I can paint all day, dig holes, do everything.
Right. Is it like a rack, is it, Graham, or it's
exactly like the Sydney Harbour Bridge. It's high at one end, a little bit low on the other.
Right, and you lie on the top of it and go up and down, do you?
No, you don't get move on it. All you do is lay on it. Right?
Right, okay.
10 minutes at a time.
Yep.
Like in the morning and the evening. After 3 months, I was pain-free.
Right. What's it called?
TrueBack.
TrueBack. All right. We'll have a look, Graham. Good on you, mate. It's worked for him.
It sounds to me like it's a stretching thing. So, and that's what we do.
That's releasing all that.
What it does is it stretches things around the joints and so forth. So that's what we do heavily. We are involved in teaching people how to stretch to keep pressure off things as well. Because our treatment doesn't fix things. It's the ongoing treatment and the stretches and the people looking after it that helps keep it
I've seen Graham, and he's used his back a lot in his lifetime. I'll give you the tip. G'day, Andrew.
G'day, Millsy, how are you?
Good, thanks. Ryan's here.
Yeah, okay, Ryan. Good afternoon. Ryan, quick question. I've been going to a very well-known chiropractor in South Fremantle, the brothers.
The Martinoviches.
Oh, I didn't mean to say that.
Oh, yeah, I know them. Everyone knows them. They're like the guru chiropractors.
Right. I've been going to the two boys there, and unfortunately one of them passed away. Mm-hmm. Who else does chiropractic work like that? I have had wonderful success there.
I think the adjustments that they do, I think the older chiropractors I know about, who don't have long since retired, the young boys, I'm not sure how they practice, but there's many different techniques that chiropractors practice. And what I recommend is have a look through the phone book, or I think they've got Google now, and just see some of the chiropractors around the area, and you can even ring their clinic and just see that if there's someone similar that does their techniques.
Ask Ted, mate. He'll tell you who he's trained up.
Okay, I know. Good on you. Thank you.
Good on you, Andrew. He's a horse manipulator as well, mate. So he's very clever, Ted.
Yeah,
he can look at it back and go, So that's out of whack. It's incredible. It's a gift.
Yeah, yep.
It's like a gift for the eyesight. But you said today, which is quite interesting, we can do it ourselves if we stand in front of a mirror and have a look at our posture.
Yeah, like I had a patient today with a headache, and I could tell because his left ear is about 2 centimetres higher than his right ear. So
Really?
I know he's been leaning away from that problem.
Incredible. If you want to have a chat with Ryan, 9361 9300, or look him up online, lampchiro.com.au. Lots of exercise. We'll see you in a month.
I'll be back.
You going on holidays again, or are you going to stay and work for a while?
No, they want me to work now.
Yeah, what a shame.